As Breast Cancer Awareness Month comes to a close, the Ontario government is taking an important step towards expanding access to screening. Maria Saru joins us now live in studio with the very latest. Good evening, Maria.
Good evening. Thanks, Taz. The province is lowering the age of eligibility to receive a publicly funded mammogram from 50 to 40. It's a big win for patients, advocates, and experts who have been calling on the government to implement this measure for years.
When Shira Farber turned 40, she asked her family doctor for a mammogram, but her request was denied. She was told she didn't need one until she turned 50, but at the age of 47, doctors discovered 3 large masses in her right breast.
There's no saying like that I wouldn't have had breast cancer. I think that's a little bit extreme, but we do know that when we detect it early, women, first of all, have a much better prognosis. Second of all, they generally need less aggressive treatments.
The provincial government announced changes today that Farber has been fiercely advocating for. Beginning in the fall of 2024, people aged 40 to 49 will be able to self-refer for a mammogram. That means they no longer have to get a referral from a doctor or primary care provider, a move Minister of Finance Peter Bethlenfalvy called game-changing.
Without the need for a referral from a family doctor or other primary care provider, this is game-changing. Make no mistake, this is a measure that will save lives and make the health care system stronger.
Medical opinions on the right age to begin screening can differ. Some experts say the risks outweigh the benefit, but Shania Leduc, chair of Breast Cancer Canada, says a body of evidence backing this change has grown for the last 20 years.
Where we've really seen the early age onset of breast cancer increase on the rise in women, specifically the value for then adjusting the mammogram screening to age 40 really is mirroring the more recent evidence of the last 2 decades.
Kim McDonald was 48 when she was diagnosed. Her doctor found a 10-centimeter tumor because her cancer was so aggressive.
I was under 50, certainly. Most women I know, and I know many women who have had breast cancer, are in their 40s and 30s.
She says early detection can be the difference between a high or low chance of survival.
Early detection is important because it's the difference between life and death for most women.
The province estimates the expansion of screening will add 130,000 mammograms annually. As regions across Ontario grapple with a diagnostic imaging backlog, Leduc says capacity and access need to go hand in hand.
Very encouraging to see Breast Cancer Canada, to see the government also stating that they were going to be increasing the resources to the screening programs, to new technologists, and even, I believe, an expansion through hospitals and MRI availability.
For many of the people who have been fighting for this change, their advocacy doesn't stop here. They have their eyes on other provinces, namely Saskatchewan and Quebec.